Welcome everybody. In today's video we're going to cover 50 high-yield questions for your ENT exam. So the first question is as important and high yield as the last one, so stay tuned. I would advise you to listen to this video several times as a last minute review for your exams, as you will find it really helpful. So let's begin. What is the most common bug in bacterial sinusitis? So they're going to give you a stem with a patient coming in with a likely sinusitis, and they're going to ask you which one of these is the most likely culprit, and the most common bug is Strep pneumo. Question number 2. Strep pharyngitis should always be treated for how long? So in the question stem, they're going to ask you, the patient's mom is asking for how long they should be treating this, and the answer is we always treat strep pharyngitis for 10 days to prevent rheumatic fever. Or they can get really creative from the point of view of test creator and ask you, we're going to treat this for 10 days to prevent what? And they're going to give you different answers, but in that case it will be rheumatic fever. So strep pharyngitis is treated for 10 days to prevent rheumatic fever. Question number 3. Treatment of choice for strep pharyngitis. So they're going to ask you again to prevent rheumatic fever, what do we treat this with? And the answer is penicillin VK. Question number 4. When can a patient with strep return to the school? So the mom will bring the child in a question stem, and they're going to tell you this is the patient with a strep, really common, and they're going to ask you, when can my child return to the school? So they're going to give you different answers. They're going to tell you right after starting antibiotics, 24 hours, 48 hours, 72 hours, whatever they want to create. But the answer is that child can return to the school after they've been on antibiotics for 24 hours. Which vaccine can help prevent epiglottitis? So in the question stem, you're going to have a patient that is leaning forward, drooling, in distress. You figure out this is epiglottitis, and they're going to ask you which one of the following vaccines in a child's immunization will prevent this, and that would be HIB. Question number 6. You should be thinking about epiglottitis in a child with presentation of what? So again, we just mentioned this. This will be a kid that's going to be sitting as you walk in, sitting in a tripod position, sniffling, in a drooling, and leaning forward. So leaning forward, drooling, have a difficult time breathing, and sniffling position, you should be thinking epiglottitis. Epiglottitis diagnostic test. So they're going to ask you, what is the next best test? Not the ultimate, but the next best test for a patient with epiglottitis, and that would be the lateral neck x-ray showing the temperate sign. You also should remember, also a high yield, that for these patients we should not be performing a physical exam, looking in their mouths, sticking looking into the mouth, because it can cause them even more pain. So get the lateral neck x-ray that's going to show that temperate sign. And here's a picture, so you can see there's a temperate sign right there. It looks like a thumb, a temperate sign. In a normal lateral neck x-ray, this will be absent. So you'll just see like esophagus going down without temperate sign. So or they can get creative and they're going to show you an x-ray and they're going to ask you, what is this? And in that case, this is epiglottitis. Alright guys, so all of these questions come from my book, PA Study Buddy for Didactic here. There's like 4,000 questions just like this that you can use for a last minute review. You can use it to study, question yourself, question your classmate. It would significantly improve your testing scores. I just wish I had something like this when I was in school. For all of you that already subscribed to my channel, thank you very much for beautiful, nice comments. I just reached 1,000 subscribers and I'm really grateful. And for those of you that haven't, hit that subscribe button. I made a video for every class of Didactic here and for every EOR, so do check those out, and let's continue. Question number 8. Otitis Media treatment. So Otitis Media is a super high yield, and you will likely encounter this during Didactic year. You will see it in your R, and you'll definitely see it during your PANCE exam. So treatment for Otitis Media is amoxicillin. I included a dosing here. Your school will likely not ask you to remember the dosing, but if you do remember the dosing for your clinical rotations, it will significantly help you to impress your preceptor and have a more successful rotation. So amoxicillin 90 milligrams per kilogram per day, divided into 2 doses for 10 days. What is the most common bug causing otitis media? So knowing which bugs cause different things is super high yield because they can give you a question, they can give you the answer for the dosing, they can give you everything else. And at the end of the question, they'll ask you what is the most common cause of this, and the most common bug causing otitis media is strep pneumonia. So strep pneumo, otitis media. Otitis media treatment if patient has penicillin allergy. I've probably seen this question twice during my PA school. So this is really common for kids to have penicillin allergy, and in case the kid has a penicillin allergy reported, likely from prior otitis media treatment, you're going to treat him with the ceftriaxone or ceftonir. So you're going to look for a cephalosporin, any cephs, and the answers will be the correct answer. So otitis media treatment with a penicillin allergy, you look for cephalosporins, ceftriaxone or ceftonir. Number 11. So you treat this kid with amoxicillin for otitis media and it fails. So the kid comes back 2 weeks later and mom says he's still hurting, amoxicillin didn't work, so what is the next line of treatment? And that would be augmentin. And augmentin, I always kind of associate with like just the first two letters, like ow, ow, that hurts. So ow, ceftriaxone and amoxicillin didn't work. Ow, what am I going to give him? Well, I'm going to give him ow, augmentin. Number 12. Most common bug. Again, guys, you can see there's a super high yield stuff to know all the bugs causing different ear infections, throat infections, because this is easy to make questions about. So knowing this stuff will significantly improve your testing scores. So most common bug causing otitis externa. So this is a pain when you move a patient's ear, and this will be Pseudomonas. Pseudomonas, otitis externa, staph pneumonia with otitis media. What would happen if intranasal decongestants are used for greater than 5 days? What can that cause? So they're going to give you a question stem, and you're going to tell your patient has been taking intranasal decongestants, but now they've been taking it for 7 days, and this patient is most likely at increased risk for what? And that would be rhinitis medicamentosa. So this is an easy word to remember: rhinitis medicamentosa, greater than 5 days, intranasal decongestants. What is the treatment for allergic rhinitis? Treatment for allergic rhinitis is intranasal glucocorticoids, fluticasone. So for allergic rhinitis, intranasal glucocorticoids, fluticasone. One of the other things that really helped me when I was in PA school was to create little mnemonics, create little stories to help me retain information. And when it comes to test-taking strategies, I would always read the last sentence first, so that I can see what the question is asking me, what's the most common, what's the next step, what's the most common bug, X, Y, Z, and I will look at the answers, then read the stem. So something in the stem will point me to what's the next best step for this, and usually it would work out within a couple of sentences. It would help me save time. I never felt pressed for time. I never felt that anxiety, so something that works for me may work for you, so check it out. Nasal polyps can be seen in kids with what other disease? And that would be cystic fibrosis. So if you see nasal polyps in a question stem, cystic fibrosis should always be in the back of your mind. And if we are talking about pediatric patient, that patient should be checked for cystic fibrosis. Most common cause of mastoiditis. Well, for mastoiditis to happen, it's going to be either prolonged or inadequate treatment of acute otitis media. Number 17. So how do we treat that? A mastoiditis treatment is IV antibiotics in this case, and meningotomy. So they're going to go in and cut that out. So IV antibiotics and surgery. Mastoiditis, IV antibiotics, and surgery. Meningotomy. What is the most common location of epistaxis? So the question stems something along the lines: patient comes in, they got very frequent nosebleeds, and the mother is asking what is the most common cause of this, or a question stem will be just like, what is the most common location of the nosebleeds? And that would be the anterior Kisselback plexus. So location of epistaxis, anterior Kisselback plexus. And Kisselback's plexus, so Kisselback sounds like kiss. And I would just think like, what is the best treatment for a nosebleed? Well, just kiss that nose. So kissing the nose stops the nosebleed. It's how I remembered it. So anterior Kisselback plexus, most common location for epistaxis. What is the most common cause of the nosebleeds in children? So they're going to give you a stem with a nosebleeds. They may even tell you this is a bleed from Kisselback plexus, and they're going to ask you what's the most common cause, and that would be the fingernails. The kid is just picking their nose too much. So picking their nose too much likely will cause a nosebleed. Number 20. What kind of epistaxis should be referred to ENT? Well, when it comes to referral to ENT, that should be something serious that you're going to see in an urgent care or an emergency room, and that would be the posterior bleed. So posterior bleeds get referred to ENT. What is the most common artery involved in the posterior epistaxis? So this is really high yield because from test creating point of view, they can list 4 different arteries, tell you this is a posterior epistaxis, and they're going to ask you which one of these arteries is most likely involved, and that would be sphenopalatine artery. So sphenopalatine artery, posterior epistaxis, referral to ENT. Peritonsillar abscess treatment. So treatment for peritonsillar abscess is immediate drainage, and you're going to prescribe IV clindamycin. So they're going to list immediate drainage and something else, IV clindamycin and something else. The answer is immediate drainage and IV clindamycin for peritonsillar abscess. That's your hot potato voice on presentation. Child with epiglottitis and severe distress should go to where? If the child has epiglottitis, you're going to get the lateral neck x-ray, you see the temperate sign, and you worry about this child's airway. So this kid should go to the OR to establish surgical airway. This is super high yield. I remember seeing this question somewhere along my PA career, or it could be a pimping question during your clinical year. So, but anyways, child with epiglottitis in a severe distress goes to the OR to establish airway. Number 24, sinusitis presentation and treatment. So for sinusitis, they're going to present with congestion. They're going to have that yellow-green nasal discharge. They're going to be coughing. They're going to have that scratchy throat. Their face feels full. So just kind of all that sinus pressure plus the cough, scratchy throat. Acute is considered to be less than 4 weeks. So supportive treatment if it's less than 10 days of onset. So pay attention to how many days they report in a stem. So less than 10 days in supportive, greater than 10 days, you're going to give them Augmentin or Oxy. Ow, those sinuses really must hurt. That's how I remember that. Ow, those sinuses hurt. Augmentin. Oh, sorry guys. Clicked the wrong button. 25. Steeple sign on x-ray should point you to croup. So steeple sign on croup, that's that seal barking cough, and you can see it on the x-ray here. So you can see the lateral, you can see epiglottitis as a temperate sign on the lateral x-ray, but on AP view of the neck, they're going to give you that view, and you can see it looks like a steeple. So that's a steeple sign, and that is croup. What is the most common bug causing peritonsillar abscess? So when it comes to abscesses, it is strep pyogen. So strep pyogens, and the way I remember this one, because it was really hard when I was studying the next day, I tried to recall and I couldn't. And the way I came up to like a little story to remember it is pyo in the strep pharyngitis. Pyo sounds like pie. And I would just ask myself, if somebody has a peritonsillar abscess, what do they like to eat? And I would say, people with peritonsillar abscess, they like to eat the pie, pyo. And I would just look for pyo in the answers section, and usually there's only one strep pyogens, so they're going to list strep pyo, they're going to list like Pseudomonas, strep pneumonia, and something else. With the abscess, people with abscess, they like to eat the pie. Abscess likes to eat pie, strep pyogens. Muffled hot potato voice should make you think of peritonsillar abscess. Peripheral vertigo symptoms are, so patient comes with the vertigo, And in order for you to know this is a peripheral versus central, the symptoms are going to be acute onset of dizziness, nausea and vomiting, and most importantly, they're going to have that horizontal nystagmus. So if you see horizontal nystagmus associated with vertigo, think peripheral. Acute onset of dizziness, nausea, and vomiting can be present, it may not, but horizontal nystagmus will be. So horizontal nystagmus, peripheral vertigo. Peripheral vertigo test of choice is Dix-Hallpike. So Dix-Hallpike is peripheral vertigo test. How about central vertigo? What does this due to? Well, central vertigo will likely be due to the lesion in the inner ear. So lesion in the inner ear, central vertigo. Posterior cervical lymphadenopathy should make you think of what? So patient comes in, you do an exam, and they got those posterior cervical lymph nodes inflamed. That should make you think of mono EBV, Epstein-Barr virus. So mono posterior cervical lymphadenopathy. Mono patients should avoid doing what? This is an easy question to make. So they can tell you this is patient that comes in with posterior cervical lymphadenopathy. They may tell you this is mono, and they're going to ask you, mothers ask, is there anything that my kids should be avoiding? And they're going to list 4 different activities. The answer is any contact sports for 1 month. So you can see how this is easy to make a question. They can say swimming, they can say running, they can say biking, and contact sports. So the answer is any contact sports for 1 month, patients with mono should avoid. What is the test of choice for mono? And that would be heterophil antibody test. Heterophil antibody test for mono. What is the most frequently diagnosis in child presenting with fever? If the child presents with fever, you should be thinking of otitis media. They're going to be unhappy, they're going to be screaming, crying, and if they have fever, otitis media should be high on your differential because that is the most frequently diagnosis in child with the fever. Frontal sinus are not visible on x-ray until what age? Again, another easy question to make. They're going to give you a question stem, they're going to tell you about a patient that comes in, they're going to show you an x-ray that does not show frontal sinuses or may show it, and they may ask you until what age we cannot see frontal sinuses. The answer is 5 years old. So 5 for frontal sinuses. 35. Pale buggy nasal mucosa should make you think of allergic rhinitis. Allergic rhinitis, pale buggy nasal mucosa. What is the most common cause of chronic cough in children older than 3 years old? Because different age has different presentations, and knowing your most commons is super high yield because you will be pimped on this during your clinical rotations, and it will be likely appearing on your exam. So most common cause of chronic cough in children older than 3 is asthma. Diphtheria treatment. So diphtheria is treated with antitoxin to neutralize the toxin and erythromycin or penicillin to eliminate bacteria. So they're going to give you a question stem, you figure out this is diphtheria, and they're going to ask you what's the treatment, and the answer is antitoxin and erythromycin. Tetanus spasms can be reduced with what medication? Tetanus spasms can be reduced with diazepam. So again, they're going to give you a question stem, and a patient stepped on a nail, they got tetanus, they got muscle spasms now, and they're going to ask you which one of these medications will likely reduce their spasms, and that is diazepam. What is the treatment for tetanus? And that would be metronidazole plus tetanus immunoglobulin. So metro, tetanus immunoglobulin. Another way I remember this, every time I think about tetanus and the treatment, I just think about treating tetanus in a metro. While I'm riding a metro, I'm just treating a tetanus. So metronidazole, and again, plus tetanus immunoglobulin. 40. Abrupt stopping of steroids can cause what? So steroids are really good anti-inflammatories, they're prescribed a lot, but if you stop them abruptly, this can cause acute adrenal insufficiency. So acute adrenal insufficiency can be caused by abrupt stopping of steroids. Meniere disease is what? This is increased pressure within semicircular canals. So question stem, they're going to tell you patient comes in with the hearing issues, vertigo, XYZ, and they're going to tell you there's increased pressure within a semicircular canal. This is most likely what? And the answer is Meniere's disease. And the triad that we likely hear during your exam is decreased hearing, ringing in their ears, and vertigo. How do we treat it? Well, we treat it with HCTZ and telling patients to decrease their salt intake. HTCZ and decrease salt. What is the treatment for croup? Well, this is another one that can be easily tested. They're going to give you that steeple sign. They're going to tell you the patient has that steel barking cough, and they're going to tell you how you want to treat this. So the answer is nebulized saline or nebulized racemic epinephrine, and that's likely what you will see in your test, is a nebulized racemic epinephrine for children with a resting stridor. So if the kid has a resting stridor, epinephrine. If they do not, just do nebulizing saline. Acute sinusitis, test of choice. So patient comes in, they got that fullness in their face, all those other symptoms, that nasal mucosa, green yellow discharge. You will get a CT sinuses without contrast order for these patients. 46. When do we give antibiotics for sinusitis? So this is a common bottle you'll see in a battle. You will see in urgent care, because patients are always asking for antibiotics because they think it's just going to take care of it. But that's not the case if the symptoms are less than 7 days. So if the patient has sinusitis less than 7 days, the likely cause is the viral. And if they present with 10 plus days, then it's bacterial, and then you can treat it. Most common bug in chronic sinusitis, and that would be Staph aureus. Staph aureus for chronic sinusitis. What's labyrinthitis? That is inflammation of the vestibular portion of the cranial nerve 8. So labyrinthitis, cranial nerve 8. And is treated with meclizine. Meclizine treats inflammation of the vestibular portion of the cranial nerve 8, labyrinthitis. What is the treatment of choice for nasal polyps? So again, nasal polyps highly associated with cystic fibrosis in children, and is treated with the intranasal steroids. Alright guys, that brings us to the end of this video. Check out all other videos. Hit that subscribe button. Check out a book. These questions will significantly improve your testing scores, and I will see you guys in the next video.